Good morning, everyone. I am Dr. Jeffrey Sterling, the Surgeon General for Alpha Phi Alpha Fraternity Incorporated, and it is a wonderful day to be learning. Um, this topic is supposed to be fun. It's going to be interesting, and I applaud the attendees for wanting to increase your IQ when it comes to matters of your health. One of my favorite sayings is that everything that you place in your mouth either hurts or helps you, and we're going to get into why that's the case today and why that may actually be even more so the case for those who are blood cancer patients. So we have a robust panel of experts today, and we're going to be talking about focusing on cancer symptoms and making you more aware and how things get treated. But as much as anything else, we are coming to you with the notion that we want you to stay ready so that you don't necessarily have to try to get well. So having this factual information at your disposal can help in all of those regards. So let's just jump right in. I'll first be introducing our wonderful panel that we have here. It includes Dr. Jerome Butler, who is an oncologist. We have nutritional advice coming from Heather Knudsen and Margaret Martin. They both are also cancer specialists. We're going to have wonderful testimony from Mel Mann, who is a blood cancer patient. And we are going to have Blood Cancer United itself represented by Rodney Jones, who focuses on community outreach and support. I want you to take your time and really get into the weeds of these conversations because if you are already here, that means you care enough to learn. And we're going to be focused on getting you some information that you can walk around with and that, believe it or not, matters because health is nothing less or nothing more than the sum of thousands of decisions that you make. So let's get you on the path toward making better decisions. First up, we have Dr. Jerome Butler, our resident oncologist, who's going to be talking to us about understanding symptoms and we'll present some treatment options as well. So welcome. Good morning, Dr. Butler.
Thank you, Dr. Sterling. It's a pleasure to be back. So again, I'm Dr. Jerome Butler. I'm a radiation oncologist in Charlotte, North Carolina. I'm about to celebrate my 30th year of being an Alpha brother this coming year, and I'm super excited to be here and to participate in this conversation. Um, as Dr. Sterling stated, I've been tasked with asking or talking about the medical insight in blood cancers or leukemia, lymphoma. And so my overview is quickly going to discuss an overview of common blood cancer symptoms, those overlooked and misunderstood, the importance of early diagnosis and available treatment options. I'm going to try to quickly address the myths and misconceptions about cancer treatment in the Black community. And then I'm going to encourage regular health check-ins and self-care and kind of hand the torch over to our resident nutritionists that are online today as well. So just starting off. So, what makes it difficult is blood cancers. And when we talk about blood cancers, we're speaking about leukemia, lymphoma, multiple myeloma. They can begin pretty subtly and mimic everyday illnesses. And that's the problem. People dismiss the early warning signs and symptoms because they're just regular signs and symptoms of fatigue, aging, stress. But it's really important that we pay attention to our bodies, as Dr. Sterling has been stating. And these frequently overlooked or misunderstood symptoms include persistent fatigue or weight or weakness that's just not normal, unexplained weight loss or loss of appetite. So again, at times we lose weight, but if we're not trying to and our dietary changes really don't make sense, then actually we should be checking that out. Frequent infections. So why is our immune system weak? What's happening? Why are we getting and having infections? Easy bruising or bleeding, swollen lymph nodes in our neck, especially, or armpits or groins, and then night sweats and fever. So these are things that we need to think about when we start having these symptoms and seek medical evaluation if they occur. The importance of early diagnosis, I mentioned, I'm going to speak about. So, in all cancers, in solid tumors, liquid tumors, blood cancers, of course, the better we do better if we can diagnose earlier. So, early detection is the most powerful tool that we have in our box. And treatments are more effective when we actually diagnose earlier. We can have less aggressive therapies and the quality of life can be better maintained. So again, we want to try to have a diagnosis early if we're going to have one. Also, there are so many modern diagnostic tools nowadays, from blood tests to bone marrow biopsies to molecular testing. And again, if we can get you into a physician early, we can hopefully figure this out pretty quickly. The next question is, what options do we have? Are there treatment options for blood cancers? And there are. There are multiple treatment options from things like chemotherapy that we've heard about and are sometimes scary, but again, new chemotherapy agents are more tolerable, and we have targeted regimens that are tolerable. Immunotherapy, and that's actually using the body's immune system to fight against cancer cells. Stem cell or bone marrow transplants. So we're trying to replace damaged cells with healthy ones to rebuild our immune system. And then, as I mentioned before, I'm a radiation oncologist, and we use this selectively to treat localized disease or for symptom relief. So again, amazing things out there for treatment. And then to kind of wrap this up a little bit, we need to talk about what's evident and what's common in our community, and those are myths and misconceptions. And we need to kind of put them out there so we can actually dispel them. So, one myth is cancer is a death sentence. And the truth really is that most blood cancers are highly treatable and even curable with modern therapies. Another myth, chemotherapy always makes you extremely sick. There are again newer therapies, as I mentioned before, that are better tolerated with personalized dosing and supportive care that actually is very tolerable. Another myth in the Black community, clinical trials are unsafe or experimental. Well, again, clinical trials are essential to improving treatment, especially for us and our patient population, so that we can understand what works effectively for us. Another myth, if I feel fine, I don't need to see a doctor. I hear this every day. And unfortunately, things can progress silently, and actually preventive care and routine blood work are critical. So we want to encourage health, wellness, and prevention, regular checkups, exercise, regular physical activity, nutrition, which you're going to hear a little bit about. So focusing on a balanced diet, rich in fruits, vegetables, protein, lean proteins, and grains, hydration and rest, and then again, mental and spiritual well-being. And so, my closing message is that blood cancers can affect anyone, but awareness, trust in medical guidance, and a proactive approach to self care can make all the difference. Within our community, breaking the silence around these symptoms and supporting your family members, friends, and one another in seeking medical attention makes all the difference.
Your comments really bring a lot to mind. Can you just give us one piece of advice for the individual that's sitting there now who feels like they're healthy but is interested in this topic? Is there one thing that should spur them to go see their physician, either in general or with any type of concern for cancer?
Yeah,
What
so, I think if you have a family history, if you just feel like your health has changed, if something that you've seen resonates with you of why your body is feeling different, we are our best advocates for ourselves, right? Because we're intuitively knowing what's happening. I think that's why we need to present to our primary care physician or to someone we trust to tell them that something may be going on.
That's fantastic. You're picking up what I'm putting down. I appreciate that. And we like to be proactive around here, and we want people to understand that you are going to be the best steward of your own healthcare. Your actions have consequences and they aren't always negative. So some of the more positive things that you can do is just to nourish your body. And that's where we're going to pivot this conversation because nutrition means so much and we take it for granted. As I said before, um, garbage in, garbage out, as the saying goes, but let's be more educated here and say that a good diet or better nutrition, I should say, dieting is something else, actually leads toward better outcomes all the way across in your health. So to that end, we have just a wonderful twosome of nutritionists, registered dietitians that are going to be having a conversation with us next. First up, we're going to be talking to Margaret Martin. And tell us what it is you want us to know with respect to nutrition care and why nutrition is as important in cancer care.
Thank you, Dr. Sterling, Dr. Butler. Um, Today, we're going to talk a little bit about nutrition during cancer care and as well